Thank you, Chair. The meeting is now live.
Thank you very much, Kirsty. Thank you. And good afternoon, everyone. I'd like to welcome everybody to this public virtual meeting of the Local Outbreak Engagement Board. Please note that the meeting is being broadcast and recorded. And if we can move to agenda item 1, the first item on the agenda. Are there any apologies for absence, please?
Chair, I've received apologies from Fiona Slevin-Brown, Sarah Bellers and Elena Rosell, although sometimes there are problems accessing the meeting through digital technology, so any members of the board who are not present and who have not provided their apologies will be recorded as having provided their apologies.
Thank you very much indeed. Thanks, Kirsty. Thank you. Members of the board, please turn on your microphone and confirm that you're present as Kirstine calls your name. And as she says, anybody who doesn't respond will be recorded as giving their apologies.
Councillor Dr. Barnard.
Present.
Councillor Bettison.
Present.
Councillor Birch. Councillor Brunel Walker.
Present.
Andrew Hunter.
Present.
Abby Thomas, sorry.
Present.
Kelly Williams.
Present.
Charlotte Pavitt.
Present.
Elena Rosell has provided her apologies. Acting Inspector Sophie Gardner. Fiona Slevin-Brown has provided her apologies. Philip Bell.
Present.
Other attendees with standing invites, I'd like to call your name. Please confirm if you're present, please. Timothy Whedon.
Present.
Tessa Linfield. Sarah Bellers has provided apologies. Councillor Mrs. Hayes. Councillor Harrison.
Mrs. Hayes here, sorry, Councillor Hayes here.
Thank you, Councillor Hayes. Councillor Harrison. Councillor Hayden. Councillor Turrell. James Sunderland MP. Jerry Barber MP.
Not MP, but present.
Oh, sorry. Adam Afria MP. And Mary Stamp.
Present.
Thank you. Are there any other persons in attendance whose names I have not called?
Sabrina Qua.
Thank you, Sabrina. Thank you. I believe we have a member of the public in attendance who will be recorded as iPhone user and in discussions will be referred to as service user M. Thank you, Chair.
Thank you very much indeed. Thank you. And agenda item 2 is declarations of interest. If any member has a disclosable pecuniary interest or an affected interest to declare, please indicate in the meeting chat and I'll come to you in turn. Okay, I don't see any interests being declared. So then if the usual conditions apply, if the discussion should take any unexpected turn and you wish to declare an interest at any point in the meeting, please don't hesitate to draw our attention to that fact. Agenda item 3, is there any urgent items today, please?
No, Chair, I'm not aware of any.
Fine. Okay. Thank you very much. So the next agenda item, item 4, is to review the current data that relates to the level of COVID-19 infection rates nationally and within the borough. Over to you, Charlotte.
Thank you, Chair. It'll be Sabrina Qua who presents today.
Okay, thank you. Sabrina, welcome.
Hello, can everyone see my screen?
Yes.
Okay, I will just make it large. Better. So as of the last 7 days, that is the period between the 4th of March and the 10th of March, the 7-day case rate per 100,000 population was 37.5. That is actually 6% higher than the week before. In the over 60s, it stands at 24.4, which is 20% higher than the week before. So we are starting to see the case rate creep up just a little bit. There have been 6,903 confirmed cases of COVID-19 so far, and 46 in the last 7 days. When we look across the area, we can see most areas are below 50 per 100,000 population, but over to the west, you can see a few of those boroughs are above. And actually, as rates increase, it may show a different picture in the coming weeks. As we break this down by age, over in Bracknell Forest to the left, you can see that 57% of cases are between 35 to 64. So that is the majority of cases fall within that age range, which is actually the highest compared to other boroughs within Berkshire. COVID mortality, there has been 1 death in the past week, and at the moment, all-cause mortality is at 16% higher than the previous 5-year average, which is 135 additional deaths. Looking at hospital admissions, there has been a note from Frimley that says that admissions are falling, and they are now falling to a rate of similar to pre-COVID levels. However, pressure amongst mental health institutes continues to be high. You can see also here that inpatients and daily admission rates are falling. Looking at vaccinations, so between those aged 16 to 64, there have been nearly 12,500 vaccinations for dose 1. And for those aged 65 and over, there's been around 14,000 vaccinations in Bracknell Forest. By age group, you can see at those aged 75 and over, if you look to the right of the chart, it's in yellow, which means that the case rates are very close to 0. So due to the vaccinations, the infection rates in those aged 75 and higher is falling much more compared to other age groups in Bracknell Forest. Looking at ward level rates, we can see that between 27th of February to 5th of March, the rate was highest in Wildrings and Central and Binfield with Warfield. However, due to the small numbers, as you can see, it ranges between 5 and 10. It won't give the exact number because it's small numbers. It does create a lot of skewing, and therefore it's not accurate to infer that these have higher rates compared to others. Looking at a ward level, as I said earlier, some areas show as having slightly higher rates, but as the numbers are so small, it's not the clearest picture. In terms of household clusters, it shows that in the most recent 7 days, 69% of cases were attributed to someone in their private residence also being a positive case, which is lower than previous weeks. 9% of cases were attributed to education, so in a school-based setting. Thank you very much.
Thank you very much indeed, Sabrina. Thank you. Does anybody have any questions for Sabrina on the figures? I don't see anybody indicating. Okay, in which case, thank you very much indeed, Sabrina. That was very helpful. Thank you. The next agenda item, agenda item 5, is a communications and engagement update at national and local level, and this is going to be taken today by Abby. So, Abby, over to you.
Thank you, Chair. Our current communications priorities across the comms team continue to be testing and vaccinations. In terms of testing, we're taking a multi-channel approach to both the lateral flow tests and the PCR testing. It's been a real focus on the back to school testing and business testing over the last week. And we're pleased to say that Bracken Forest has been recognised on a national webinar for the way in which we've engaged with communities on lateral flow testing, and it's been seen as a best practice example by DHSC, which is great news. Our work in terms of videos on lateral flow testing has been particularly recognised and been particularly successful in resonating with residents. In terms of vaccinations, internal and external campaigns continue. We're making greater use of statistics to try and encourage behaviour change, and also to motivate, and particularly putting a focus on human voices and stories and capturing as many case studies from local residents as possible. In terms of the roadmap, we're continuing to focus on the stay-at-home message and the health and hygiene measures, particularly as now weather's starting to improve and schools have returned. And there are a number of events coming up, including the Easter bank holiday weekend in a couple of weeks. Well, there might be a temptation for larger family groups to gather and get together. So we're preparing comms and assets in advance of those. We'll be switching to the Stay Local promotion message from the 29th of March. And we're also mindful that shielding may be lifted at the end of March, and are working on a comms campaign to develop our post-shielding advice and signposting. Obviously, returns to school has been very significant development in the roadmap over the last week, and we've supported school colleagues to encourage children to return with confidence. Thanks schools for the great work that they've done on encouraging lateral flow testing, and that work continues. And then finally, putting some increased focus on self-isolation over the coming weeks to really ramp up the messaging, with a focus on self-isolation being different to the roadmap and people needing to abide by the self-isolation rules. Ensuring that people are really clear around the support that's available for self-isolation in terms of sort of physical, mental health, and practical and financial help and support. And also asking people just to be mindful of preparing in case they needed to self-isolate at short notice. And as we move forward, we'll need to focus more on sort of behaviour change messaging. That's going to be really important in terms of that increased focus on self-isolation. So those are the current priorities, Chair, and happy to pick up any questions if there are any.
Thanks very much indeed, Abby. Thank you. Colleagues, are there any questions for Abby? I don't see anybody indicating. No, well, in which case, thank you very much indeed, Abby, for your contributions. That was very helpful. And the next agenda item, item 6, is an update on the local outbreak management plan. And Charlotte, I think that's with you, please.
Yes, that is. Just sharing my screen now.
You've got it.
Lovely. I'll just make it slightly bigger for everybody.
Thank you.
Okay, so in terms of the Bracken Forest Council Outbreak Management Plan, as we set out when the plan was initially formed last year, that we would continue to refine, adapt and review it as we progress through the pandemic. And we've reached a point now where we're 9 months on since the first iteration of the national contain framework that really directed local plans. And we want to continue to keep our residents at the centre of the plan, ensuring their safety as we move through the pandemic and towards recovery. So since the initial draft of the plan, there's been significant evolution of the pandemic, and thus the national framework's parameters have now shifted, and we're beginning to focus more on emerging themes around enduring transmission, what's currently the dominant variant, and therefore what should our business as usual begin to look like, and also how we then adapt our response when we're faced with variants of concern and we need to expand and provide surge capacity to again limit the risk locally. So our plans are now needed to be updated in line with these national parameters around the contain framework, but they also need to meet our local priorities and needs. The national framework has set out some key themes to what the plan should look like moving forward, and they largely resonate with the original plan. I've set them out here in terms of a focus is continued on high-risk settings, communities and locations, so that we're focusing our efforts in preventing and managing outbreaks in these high-risk locations. There's a specific nod towards our vulnerable and underserved communities, and therefore the work that we've already undertaken in terms of where we are to date with the plan around reducing inequalities and ensuring those vulnerable individuals have the services to meet their needs accordingly. That's really been pushed to the fore of this plan moving forward. There's still a focus around compliance and enforcement, but again, a slightly different lens in terms of what that looks like moving forward as we emerge out of lockdown through the roadmap and towards recovery. We also need to be very clear within the plan as to what the local, regional and national governance is around ensuring delivery as we've set out to do, and also how we're going to resource that accordingly. Again, with that balance between managing the ongoing response within our business as usual, but with that balance of enabling to stand up surge capacity as required. Again, communication and engagement is at the centre of the plan, and that two-way communication and engagement, not only setting out clear messages and relaying information to our local communities, but also hearing their queries, concerns and viewpoints that we can then utilise in informing our response. And within that, really drawing and building upon the empowerment that we've seen and enabling local communities in building resilience, the great response that we've seen to volunteering and that community cohesion coming together as a result of the pandemic is a legacy that we really want to capitalise and use moving forward. And of course, the importance of data integration, information sharing and the ongoing surveillance, and really enabling us to drill down into the detail in terms of the data that Sabrina's presented earlier, to really understand where the enduring transmission is occurring. Now that we've got 46 cases in the last week, where are those 46 cases? Is there anything that we can do with those specific communities to support them to reduce transmission and to eradicate the virus from the borough? And then specifically in terms of the action and response, again, largely drawing upon the key themes of the plan previously, with a focus on local testing capacity, but obviously as that testing picture is expanding, what that looks like locally and what our role is in supporting and delivering local testing, and moving the population towards testing as the norm. Contact tracing in complex settings, and also enhanced contact tracing. So really utilising the data that's coming through when we're identifying common exposure areas, and really exploring how that data can further inform our communication, our enforcement action as well. The support for self-isolation and also for shielding is again something that's got increased focus moving forward, and we recognise locally, and they have nationally as well, unless individuals are supported to self-isolate and to shield, and their needs are met accordingly, there's no point really in putting the testing capacity, the contact tracing in place, because ultimately we need individuals to be self-isolating and shielding to protect themselves and others. There's the outbreak management response as there was previously, and this again will need to be built into our business as usual, and how we manage outbreaks moving forward when they become less and less frequent. And then finally, again, with that forward-looking view, the further activities that enable us to live with COVID securely. So again, looking at how we respond to variants of concern, looking at our surge capacity management, exploring where that enduring, challenging transmission is occurring and how we can target our action accordingly. And then what's the ongoing role of non-pharmaceutical interventions? So that's interventions such as face masks, social distancing, etc., that's largely dictated from the centre, but actually what's our role, our local role in terms of COVID marshals, for example, in supporting the community to adhere to them. And then obviously the important interface with the vaccine rollout and how we work that across the system to ensure that individuals have access and uptake for vaccine is high locally. With this update comes the opportunity to provide feedback and to reflect on some of the lessons learned to date. We've undergone lots of engagement throughout Bracknell Forest Council as an organisation, but also with our wider partners to reflect and to capture that learning to date. I've summarised that within this slide here, and would like to also offer the opportunity in this fora for the board to be able to also reflect and to input into this process as well. Generally, there's acknowledgement that across Bracknell Forest, that ability to be flexible, to respond to the data and the insight that we get locally and respond in terms of the action to meet the need and demand is something that's really come to the fore in terms of our actions to date, and something that we want to build upon moving forward. There's been some fantastic networks and best practice sharing right across Berkshire, again, that we want to capitalise on moving forward. As I've previously mentioned, the provision of the Community Response Hub and over 500 community volunteers being recruited is something that we want to build upon and have as a long-lasting legacy as we come out of COVID. And the partnership working, which again was already in place prior to the pandemic but has since been strengthened, is something that we want to continue to utilise moving forward. We are aware of the risks, particularly around COVID fatigue, the constant evolving communications and approaches that we're taking challenges COVID fatigue, but is something that is a constant risk for us locally. In addition, there's still misconceptions, and with the introduction of new programs such as the expansion of the testing program and the vaccination program, in some instances some overconfidence following those interventions, which then individuals may relax in terms of adhering to the non-pharmaceutical interventions I refer to in terms of the social distancing and the rules and regulations that are set out with lockdown or other restrictions as we go through the roadmap. Self-isolation, as I've previously mentioned, is a big barrier, and local measures to support self-isolation are very much central to our local approach, but again, national focus is needed to support that. And finally, the ongoing COVID response, this balance between business as usual activities with the plan exploring and addressing how we stand up and deal with that surge capacity is an ongoing risk, but something that we're mindful of. In terms of the issues that we've identified and where we haven't been able to deliver as we've wanted to, particularly around lack of information or comprehensive data being shared with local authorities in a timely way, we're in a much stronger position in terms of our data and our position in terms of surveillance now than we were at the start, but there's still improvements to be made. And the other ongoing issue and challenge that we face is the fast-paced emerging policy environment. The constant changing policy really challenges us in terms of local implementation. But there are also some fantastic opportunities, again, which I've picked up in terms of some of the good practice, but the ability for us to be able to build upon the approaches that we've started to look to in terms of addressing inequalities as we emerge through recovery and beyond is something that will really benefit the local population. The local relationships and communication routes that we've developed and rehearsed now in terms of outbreak management will benefit the wider health protection response over and above COVID for all our infectious and non-infectious disease risks in terms of health protection. And building on the communications and community engagement approaches, which again were very much embedded within the local authority, but looking at how we can pull those together across the system with our partners, again, so that constant communication with the local community is done in a consistent, coordinated manner. And finally, the public health intelligence infrastructure and the use of data has really grown and been challenged throughout this pandemic, but the good practice that has emerged will really benefit us in some of our other areas of work, namely the JSNA, the Joint Strategic Needs Assessment, etc., when we move forward. So I will just open it up to the board in terms of any further comments or points that you want to raise.
Thank you very much indeed, Charlotte. Thank you. Colleagues, do anybody have any questions for Charlotte? Gareth, was that an indication? No. Okay. No? Well, thank you. Thanks very much.
It's Dorothy.
Yeah, Dorothy.
I can see I'm buzzing. I've come down only to thank the members for the, well, it's not so much the members, it should be the staff and officers, but mostly the volunteers. I mean, it's wonderful when you put some papers up and can say 500 or more, and that we should be very proud of and be literally making it in our. It might be nice at one stage, because when I had my injection at Waitrose, I couldn't fault them. They were there, they were doing it, and they were doing it on a Sunday afternoon. So at some stage, sir, it would be lovely, Councillor Bettison, that we can get a nice picture of everyone, maybe on a football pitch or something, but just to show how this borough works to do something for our residents. And I want to congratulate our officers. So
thank you, Dorothy. You're absolutely right. And at some point we will have to find some way of marking the tremendous effort that the community itself has made. And so thank you for drawing our attention to that. Any questions for Charlotte? No? Then thank you very much indeed, Charlotte. That was great. And we move on to agenda item 7, public participation. Kirstine, I believe you have a question from our guest today, service user M.
Yes, Chair, we're joined by a member of the public who appears in the meeting's participants list as iPhone and would like to be referred to as service user M. They'd like to ask a question which was submitted to the committee Dropbox. The question's been anonymously circulated to all board members in full prior to this meeting, but wasn't available for publication with the agenda. I will, of course, publish the full question text following this meeting, so it is publicly available. But would you like me to read the question in full at this point, Chair?
If you can, yes.
Certainly. Service user M would like to ask the board, in view of the upcoming end of the national lockdown in the government's roadmap and the release of what is now an expanded shielding group, on this March 31st of nearly 4 million people with no announced or telegraphed plan to support this vulnerable group, we would ask that in the absence of Health and Wellbeing Statutory Board meeting until June 8th, and with many BFBC residents now in more extreme and acute need at the MH, physical, practical and support levels, we ask, firstly, that this low-ebb board wholeheartedly gives its full unencumbered endorsement to not only, 1, a user-led needs-based interim roadmap locally, 2, a high readiness working group, shielding group strategic legacy support, hereafter referred to as SGSLS, within the statutory framework so as to expedite its actions. But the wider endeavour to work with the local MPs and offices through ministerial contacts to gain short order clarity as to the government's provision or lack thereof for the shielding group moving forward. If a plan is not in place, to have through the elected representatives questions or statements tabled on the floor and effect soft influence discussions in the lobby and the other place, have Hansard reflect the government's position and render duty as our representatives to make sure government stands up a workable plan so that we may follow suit and support the many at risk on patch that have been put in harm's way with the promise of ongoing support to facilitate better outcomes and rehabilitations. Given that the LGA has confirmed no funding will be given to local authorities at this time for this purpose, and until the government signs off a plan and gives mandate to the regions with the relevant funding, it will befall all organisations locally, herein BFBC, to support messaging and comms and reinforce more robust and resilient internal workings to identify the vulnerable and signpost, reassure and give opportunity where possible to the user group until such a time as a government-backed plan is disclosed and deployed. To this end, we wish to mobilise with this from within BFBC and outlying regions, officers to form a part of said SGSLS, with a directive and commander's intent to rebuild it better, and a mantra in its activity, success is a collective endeavour. Built through the consistency of the taskings, tenacities of the team and the resolute individual, with an initial objective to achieve weekly targets on a roadmap between now and June the 8th, when further mandate and support will be required in presentation to the Health and Wellbeing Board of this group's working findings, using low-ebb learnings and figures locally initially, and the external feedback from the soft influence / direct mandate and intent clarification exercise outlined herein above. May it also be noted herein that the non-statutory functions group around these matters, meeting quarterly, are not a place for high readiness nor immediate action, nor stand during emergency function. As a member of the user base, Service User M has a disability and is shielding. During this period personally has seen a marked drop in the health of the user group's well-being. An outreached hand of wisdom through adversity serves the entire community, and a user-led service brings resilience and clarity towards better outcomes. SGSLS will be a driving force to give this user base not only a voice at this vital and pivotal time, but an opportunity for all participating organisations to learn and be at high readiness for any future needs, in line with contingencies and workable deployments under emergency planning criteria. To support this, may the local data and learned experience over periods March 2020 to date be directed, please, to SGLS via Assistant Director Abby Thomas, with support of Head of Community Engagements and Equalities Harjit Hunjan, Head of Communications and Marketing Elena Rosell, Interim Director Adult Social Care Melanie O'Rourke, and may these may these be seconded to said SGSLS for an initial bi-monthly leading to monthly meeting with action plan, review and reporting function, ethos in line with PSED and NOLAN for a calendar year from said government mandated end of shielding to run to 31st of March 2022. Service User M thanks the boards for its time, mindfulness and careful consideration of this nuanced copy, the questions and information therein, and looks forward to circling back with its chairman in the days after this meeting. Thank you, Chair.
Thanks very much indeed, Kirstine. Thank you. And Abby, are you the best person to come to for an immediate response?
Yes, certainly, Chair. Happy to provide an immediate response. That's a very long and complex question, which we're happy to take away and provide a suitably detailed answer to. However, one of the key pillars throughout our COVID response has been to act upon government guidance, and we'll continue to make sure that that's the case. In terms of our support to those that are shielding, we're currently providing information and support to over 5,800 clinically vulnerable people across the borough. And as a part of that, we've made over 10,000 welfare phone calls to clinically vulnerable people and over 800 doorstep welfare checks in partnership with the ARC. And most recently, we've been providing support to the 1,700 people that have been newly added to the shielding list. We are planning a comms campaign with advice and signposting at the end of the shielding period. It's still to be confirmed whether that will be the end of March, but we'll be ensuring that there's comprehensive comms that goes out to everybody that's shielding in terms of signposting and advice, including a booklet that will be sent out to everyone, and that will be the fifth advice and signposting booklet that we've produced over the period of the pandemic. In addition to that, the ARC community response volunteers, which Charlotte has just mentioned, are also going to provide a side-by-side support service. So they're available to accompany anyone who is lacking confidence to leave the house, whether that's just for a walk or to go to the supermarket to get food. And of course, the ARC's community response service will also continue to be able to get shopping for people and provide other practical support. Finally, I just say at this point that we'll also work with Involve and the wider voluntary sector to ensure that we coordinate our support and actions with organisations like the Red Cross and Age UK to ensure that we're all jointly joining up our resources to support those that have been shielding to regain their independence and their confidence.
Thank you very much indeed. Thank you. And can we should we then suggest that to Service User M that you'll be corresponding with him on behalf of the board with a full answer?
Yes, Chair. I would welcome a discussion and want to ensure that we provide a full response.
Okay, fine. Thank you very much indeed. Thank you. And the final item on today's agenda is to review by exception the ongoing action log for the Outbreak Engagement Board. Are there any to report under this heading? No, I don't think so. In which case, then I'd like to thank all board members for participating in this virtual meeting. And the next scheduled date for the board to meet is Tuesday, the 6th of April at 4 p.m. And I declare this meeting closed. And can Democratic Services please confirm when the meeting has stopped being broadcast?